Chris, great to have you back on the podcast. How's it been?
Jared, it's great to be here. Things are awesome.
Been over 2 years now since we last spoke on a podcast. So in startup world, 2 years is like decades, right? In terms of what can happen. So since you've already been on, but it has been a while, I'd love you to tell the audience a little bit about your background, and then give us kind of what is Neuroflow, what is new since the last time we talked. I know there's a lot, and we'll just go from there.
There's a lot to unpack there. The short story of my background, I don't come from the healthcare world or the business world. I was in the military for 10 years. After graduating from West Point, served in the artillery, deployed overseas a few times, was a platoon leader, an amazing experience getting to develop leadership and lead soldiers. Like everybody, I would say, in life in our society today, had personal connections with mental health. I had soldiers that struggled with it, myself struggled with sleeping issues and trauma and so forth. And when I transitioned out, I was in business school, which brought me to Philadelphia at the Wharton School, and just wanted to be a part of something bigger than myself, like I was in the Army. And I was looking for that. And I realized that the gaps in mental health care were not addressed appropriately. And I figured, well, what do I have to lose at that point? So I teamed up with a bioengineering PhD candidate at Penn, and we started Neuroflow. That was hard to believe. This April was our 8th birthday as a company, and so it's wild. And it's evolved and changed over the years about how we were working with mental health providers or primary care providers. One thing that's always stayed constant is this need to make mental health more objective, to fill the gaps in care, and to help make sure that people get the right type of care at the right time, and be a resource to them in the biggest moment. And we've always taken a tech and data forward approach to doing that. Neuroflow has never delivered care ourselves. We're always partnered with the professionals that are on the front lines delivering care. And so we, you know, I'm trying to, what we do today is largely described what has happened in the last 2 years. So I'll just say that real quick. 2 years ago, we did our first acquisition of a company called Capital Solution Design that had a product called BHL. And since then, we've acquired 3 other companies in 2 years. So we've acquired 4 companies in the last 2 years, which were all strategic and opportunistic, that added to both our capability and our customer reach. And we've been able to integrate them so that we're delivering even more value to our customers today, which we could go into more detail, but at high level, it's data analytics and software run across data sets like claims data and EHRs to identify and stratify behavioral health risk, coordinate care after we know that risk, and then follow up to engage and measure quality and outcomes of that care once we coordinate it and deliver it, and connect all of those pieces in the ecosystem. And today, do that with payers, with health systems, with the federal government and the VA, across 17 million users in all 50 states. And I pinch myself every day and knowing that I think we're making a real impact with partnering the providers and the payers in the world.
When you look at, since we last chatted over the last 2 years, obviously so much has changed, and kudos to you and your team on all that you've accomplished.
Thank you.
And I know you mentioned some of this in there, but 2 years is a long time, as I said earlier, in the startup world, right? A lot can happen, a lot can go right, a lot can go wrong. How, as a founder, you can't always stop things from going wrong, but how do you personally, like during like those long periods of time, mitigate any issues? Or because you're rolling out new things, right? You're learning, so it's natural to make mistakes in general, but how do you mitigate those? So I'm not going to say how do you avoid them completely. How did you mitigate any major issues over the last several years? Was there a process that you had, or was there anyone that I'll let you answer.
Actually go as far as saying you don't want to avoid them, but you want to anticipate them and then have a plan for how you're going to address them when they're happening. I think what you want to avoid is you want to avoid surprises, but not issues. So when we're trying new things and we're going to a new client, let's say we're trying to go to a new type of market, that's one, that provides different type of challenges. But even if we're doing, a rinse and repeat implementation that we've always done before. In the Army, we had a saying, complacency kills. You could go on 5 missions and at everyone, you go out, you do your mission, you come back to the base and it's safe and sound. That sixth mission, okay, this is easy. We just did it 5 times. That's when something happens. And if you're surprised, people get hurt. I think it's the same thing for us, right? We could do 5 implementations at primary care groups, helping them manage the behavioral health of their patients. And the sixth implementation, it's like the same exact use case, same EHR. If we're not constantly anticipating, okay, what might go wrong and putting and thinking ahead about what we're going to do, that's when things go awry and we get caught on our back, on our heels, and that's when you look unprofessional. That's when you lose confidence in your customers and partners. And so for us, whether we're going to new markets, expanding in existing markets, doing acquisitions, I'm always trying to think about, okay, this is the plan, but what is an alternative A, B, C, or D? Sometimes my team says, for some, I think I'm overall very optimistic, but I'm a pragmatist too. So I know for sure we're going to succeed. That's the optimistic side. But I'm also like a doomsday, uh, you know, uh, prepper in terms of always thinking about worst case scenario and putting some thought behind if that happens, how are we going to react to it? And when you do that, right, the old saying is luck favors the prepared. We have to things have to fall our way too. But if they don't, we know how we're going to react to that and we're prepared to learn from that so that the next time we're that much better.
I'll kind of kick it over to something else. Over that period of time too, you've released new products and solutions. How did you decide? How important was that feedback that you were getting to go and decide what was next? And you don't have to give us any secrets or anything, but like, where are you kind of leaning towards, like in terms of what is next now from here?
Sure. No, that's fair. I think one of my big lessons in the changes that we made over the last 2 years were trying to get away from this notion that Neuroflow was an app. I mean, when as far as making jokes about it at company events, it's like, don't call me an app. We would have signs up, everything like that. And we just beat that into people's heads. At investor meetings, we would say, don't call us an app. I think I published even an article like, don't call me an app. And the whole reason for that was we do have a mobile app that's iOS and Android, and we can white label that for our clients too. But the challenge with when you were app centric is that it carved out a bunch of people that you could interact with that didn't either have access to apps for smartphones or weren't comfortable using apps for smartphones, or for whatever reason, you would limit the breadth of the impact you can make. And so we would get customers saying, I have 100,000 people, but only 20% of them are using the app. And so then, it almost diminished the value that we were providing. And so we always thought and still think that the app as an engagement tool is an important feature of our capabilities and our tech stack, but it's not the thing. It's a feature of the thing. And I mean, one of the lessons learned is changing that positioning and people's idea of what they think of you is incredibly hard. They think you are an app. Like getting them to change that notion is very difficult. So we did some intentional things to do that. One of which was branding the app separately than Neuroflow. We call the engagement tool today Onward by Neuroflow. It's not Neuroflow is not the app. Onward is the app, and Neuroflow is the company. A few of the other things that we've done is we have several customers that don't even use Onward today, and they're using the different lower tech options like SMS engagement, like the VA uses all SMS and email engagement. And this was then the precursor to the product that we launched earlier this year, which we call BHIQ. BHIQ is the analytics and AI capabilities that look across existing data sets like claims data and EHR data to help identify those risk areas for behavioral health. And why that's such a paradigm shift for us and now our partners too is that, you know, old Neuroflow, you needed the engagement and the input from patients and members of plans into whatever system they're doing to collect that data to do the thing. Now we still do that, but BHIQ doesn't require the engagement of people with a mobile app or something like that. We're just analyzing the data that already exists in a very unique, powerful, and proprietary way. So that's been one of, I think, a huge evolution on a seismic level, at least for us, over the last 2 years. What that means moving forward is, and what I'm really excited about this is that we think interoperability and making sure that the ease of the workflow has to be paramount. So what I mean by that is I think point solutions are dead or are dying just because people are fatigued by them. Both the user, like the patient, and the providers and the nurses and the care managers just creates too much work, too much confusion and overlap. There's been several cases now where we're embedded in workflows and systems, and our customer or the end user doesn't even know that they're interacting with Neuroflow. And we're fine with that. Like we're the connector, the interoperable piece to help with these pieces. We'll show up in Epic's My Chart rather than having to download Onward, and or the provider engages us within their existing system. And we are moving forward going to be doubling and tripling down on making the system that much easier to use without workflow interruption, which there's a lot of things there that I could go into, some things, and some things I can't go into yet, but we're really excited about it because the more you can do that, the more you make behavioral health ubiquitous, because behavioral health is one of those unique specialties that impact every other specialty. Think we just launched with Christiana Care to support their OBGYN clinics in women's health. I mean, of course, postpartum depression and so forth. What about oncology? What about nephrology and diabetes? I mean, all of these specialties are impacted by when people don't have their anxiety and depression treated. It makes those other things worse. So I think the opportunity is it's really enormous, both from an impact standpoint, but also from a business standpoint.
I love it. You've been doing this now for a few years, Chris. What continues to drive you to get up and build this company?
For their own privacy, I won't go into details who it is, but I've had family members that have struggled with significantly in the last 2 years with depression and with substance use disorder. And I love them to death as my family members. And it's almost embarrassing. I'm not embarrassed for them. I'm embarrassed that I'm in this line of work and I still can't get them the support that they need. And it's just, so that's one thing on a personal level. And then you extrapolate that out. And as proud as I am to say that we have 17 million people on this platform, there are tens of millions of more people that I know are not supported today. There's tens of millions of people that struggle silently. And the tragedy of it is that they don't have to. Like, there's tons of evidence-based support, tons of funding mechanisms. There's just one thing we've done really good as a society, I think, is invest a lot in telehealth resources. I mean, we have the options for care um, are enormous today, and they weren't like that a decade ago. So now the challenge is helping people get access to them, and making sure that they're high quality. We're proud of what we've done today, but we're just scratching the surface. And if I wanted to make a quick buck and sell a company in a year or two, I wouldn't have gone in the healthcare software space. So it's about the impact that we can make.
I love it. Chris, always a pleasure to catch up. Let's make the next chat earlier than 2 years from now because I know there's still going to be a lot of stuff happening. And wishing you and the team all the best of luck.
Thank you, Jared. I appreciate it.